Hi, Dr. Rosenberg again. Today I wanted to talk a little bit about strengthening exercises because there's a lot of confusion over what kind of exercise is right for me. So, we'll start with the basic exercise. It's called isometric exercise. And what isometric exercise means is you don't move the joint. If you listen to our vignette on arthritis, I mentioned one of the most common mistakes made in treating arthritis is patients are given repetitive exercises to do. That's the wrong thing. You want an isometric contraction. Hold, contract, hold it for 10 seconds, and relax it. You can get every bit as strong with isometric exercises as you can with any other kind of exercise. The one danger to be cautious of is don't hold your breath, because you'll be shutting down supply to your heart. So when you do isometric exercises and you want to say we want to do a bicep exercise, all I got to do is, this would be a normal bicep exercise, this would be the isometric version. I'm using the biceps, I'm pressing up against this, the joint is not moving, yet my biceps is contracting right now. That's isometric exercise. As opposed to the most common kind of exercise, which is isotonic. Isotonic exercises moves a weight through space. So that's your classic, hold some dumbbells here, bring your arms up and down, up and down, up and down, and you do various repetitions. That's your standard isotonic kind of exercise. Now, more recently, there's a new form of exercise known as isokinetic exercise, which essentially means variable resistance. And isokinetic exercise is very interesting because it takes into account biomechanics of your body. Let me give you an example. If I ask you to do a standard leg isotonic exercise, put a little weight on your ankle, and you'd lift it up, and you'd put it down. But you will notice when you move that way, that moving it in here, when you do not have a lever arm working against you, it's pretty easy. Yet when you move it the last 10 or 15 degrees, that's when you feel it in your muscle. Because in this position, biomechanically, you have a long lever arm with a weight on your ankle, which makes this much, much, much more strenuous here versus when you're down here. It's not as strained here. What does that mean? It means when you do a standard isotonic exercise and you move a weight like this, you are wasting your time in here. You're not getting any pressure on the muscle. You're only getting strengthening these last 10 or 15 degrees. So what isokinetic exercise says is let's vary the resistance based on the body mechanics. So in this case, you would have more weight here, and then as you got higher, the weight would relax, you'd have less weight, so you'd actually now get strengthening through the entire range of motion. And that's very, very unique and very, very important.